So we are very happy to have with us Dr. Hira IMG, who is going to share her experience of being a doctor. She will answer one question, what she likes the most about medicine, and she will give an advice to you as future students in medicine. And she will tell us a little bit, because her field is obstetrics, about some important medical conditions in her field. So, Dr. Hira, can you tell us what you like the most about medicine and one advice for the students?
Hi, Dr. Silverman. Thank you for having me. Hello, everyone. I hope everyone is safe in these challenging times. I'm proud to be a physician, and my specialty is obstetrics and gynecology. My experience so far of 10 years in medicine has been great. It has been a little tricky for me when I came to Canada, but it's all good. I'm struggling towards getting my license here. But one thing I want to say about medicine is that you have to be determined, you have to be consistent in whatever you do. You have to work hard to achieve your goals. That's what Dr. Silverman has taught me. And I am in the phase of working hard. So, one thing I would like to say to all the medical students is that um, choose your goals. Try to find from the very beginning what interests you the most, and then pursue for that goal. Going forward, I would let you know about some of the important topics in obstetrics and gynecology. It's particularly related to both women's and men's health, which is sexually transmitted infections. I think it's very important for all age groups, especially reproductive age group, which mostly starts from age 13 onwards, so till 45, to know that every women and men are at a high risk of sexually transmitted infections unless and until they do something for their prevention. Um, there are a few sexually transmitted infections which are common. The most common is caused by a virus, which is known as human papilloma virus, um, also abbreviated and called upon as HPV. There are certain types of HPV viruses which cause the infection, and some of the types also cause cancer if the infection remains untreated for a longer period of time. Those two types, the types which cause infection are types 6 and 11, and HPV types 16 and 18. And I guess there are a few more. I'm not sure about those numbers, but 16 and 18 are the most common types, so that are responsible for causing cancerous changes, metaplasia, and dysplasia in the cervix of the female reproductive system. I'm sure you already watched the video of the reproductive system. I was aware of that, and I hope it was interesting for you all. Um, Going forward, I want to talk about the prevention of HPV, like sexually transmitted infection, and HPV in common. Um, it is one of the contraceptive methods as well, which is barrier method. Condoms are one of the barrier methods, and they help in reduction and prevention of sexually transmitted infection. The other important thing would be the knowing about it, having the knowledge, having the proper counseling of sexual practices, and obviously the sexually transmitted infections. And I think it's important for both men and women, girls and boys, to have that knowledge. Um, the other thing is the other infections, sexually transmitted infections, are Trichomonas vaginalis, the other syphilis, and the other common hepatitis B and HIV. I'm pretty sure all of you are in med school and are aware and have heard before about all of these diseases, but they do have a huge impact on particularly women's health. And if these sexually transmitted infections are not treated for long and are ignored, then they can cause common morbidities in women, like infertility, pelvic inflammatory disease, which can further be a cause of chronic pelvic pain, which can be very debilitating for women. So let's talk about the clinical presentation. The most common signs and symptoms would be of sexually transmitted infections, and in particular HPV. I'm going to talk about is you can have lesions. Those are called the genital warts in men, and in women you can have you can also have warts. You can have women can describe them as like outgrowths, that they feel something on their skin. So I think it's very important to go to your primary care provider or your family physician to discuss with them and see what are the options. The other symptom, which is a very common one, could be a vaginal or penile discharge, which could be in yellow green uh, color. It could have blood as well sometimes if it's severe. And some of the women can have pelvic pain as well, can have pain with intercourse. Um, these are the common symptoms. Sometimes fever if it's like if it has already spread to pelvic inflammatory disease, then can have more acute symptoms and more severe symptoms like fever, maybe vomiting, abdominal pain, and like a feeling of sickness. But usually, if you notice it from the very beginning, it's not that acute. So it's important to understand to know the signs and symptoms and to pick them up and to discuss with your healthcare provider. And then comes the treatment, the specific treatment for HPV. There are treatment like there are topical agents which treat the HPV. Um, uh, those include topical acetic acid and podoflin. Um, Also, a few people ignore it's in I'm mentioning this because it's important because the genital warts do regress after some time, but they do recur. So HPV can remain and it can remain in your vaginal flora and can cause future morbidity like PID and infertility, and also cancer. So the warts do regress, but you have to make sure that you get treated for it. The prevention for HPV are the vaccines, both for men and for women. For men, it starts from age 11 to 26, and 9 to 26, and for women, it's from 9 to 45. It's best advised to have those vaccines before you become sexually active. But if in any case some people don't know or they don't have access to healthcare, they can always have even after initiating or starting the sexual activity. Um, there is a contraindication to the HPV vaccine. If the patient is pregnant, you should not advise to them to get the vaccine, as it's a live vaccine and it's not safe in pregnancy. It's the vaccine is so far very safe and can have common side effects of a vaccine. Nothing major than that. Other than that, um, yeah. So these are my recommendations. That it's important to pick up the symptoms. It's important to know what STI looks like. It is important to know what is the treatment, when to go to your doctor, when to discuss, and what are the preventive methods. Preventive methods are barrier methods, just summarizing, and also the vaccination. It can be cancerous, but certain types, and there are other risk factors for cancer, but obviously risky sexual behaviors, um, lack of like a long-term infection with HPV, and lack of hygiene, smoking. These are the other family history as well. These are the other risk factors for cervical cancer. Um, so, yeah, Dr. Silverman, I don't know
That
if
was
you have.
fantastic. It was great. I
Okay,
didn't share the video. I am going to share the video after you you are done. So
okay.
so
So,
anybody, huh?
yeah, any
Yes,
questions
yes.
from anyone?
Anybody has any questions for Dr. Hira? It was fantastic.
Thank you.
Uh, you if the students you can put the questions here or you can ask them for Dr. Hira.